about it, especially if you're really between 55 and 60, although I think everybody ought to hear this conversation today. But if you're between 55 and 60, I would ask that you tune in even a little bit more to what we're talking about today. So John kind of alluded to some of the numbers, and let's talk about that. Fewer than 1 in 30 Americans own a long-term care insurance policy, and only about 7% of adults over 50 do. Common estimates, though, say that about 50% of older adults will need long-term care at some point in their lives. And if you're over 65, the odds shoot up to 70%. So that means it's highly likely, as John suggested, that at least one person out of a couple will need this type of help. And the costs are, as you know, astronomical. We're going to put some numbers behind it. Everybody knows, generally speaking, that it's very expensive. But let's talk about the average. Assisted living, and these are national averages, so I always kind of temper that with if you're living in the South, things may be a little bit less than this. Yeah. But statistically, nationwide, assisted living runs about $48,000 a year. Home health aides can cost more than $52,000 a year. And a private nursing home, the care cost there can shoot over $100,000 a year. That's according to a 2019 GenWealth cost of care study. So when you think about it, matching these two things up, statistically, you are likely, at least one of the two of a married couple are likely to need this care, and we just threw those numbers out at what they are likely to cost. You have to address this as part of your financial plan.